I would like to go ahead and introduce our speaker today, Ms. Jacqueline Nesenberg. I hope I said your name correctly. She's completed her Master of Public Health at Georgia Southern University, and she holds a BS in Biology from Iowa State University. She is currently enrolled at the Jiann-Ping College of Public Health at Georgia Southern University, working to achieve her Doctorate of Public Health with a concentration in leadership. Jacqueline has presented at various conferences throughout the country, including American Public Health Association, Georgia Public Health Association, and Georgia State University Conference. She has held a multitude of leadership positions, including the Dean's Advisory Committee, Graduate Student Organization, Georgia Public Health Association Career Development Board, Coastal Georgia Indicators Coalition, and Georgia Southern University Strategic Planning Board for Teaching and Research. Jacqueline has been awarded the Graduate Student Leadership and Service Award, the APHA Sexual Violence Photo Voice Award, Iowa State University Employee of the Year, and Best Graduate Poster Presentation at the APHA Conference. In her previous work as a Public Health Promotion Graduate Assistant, she was responsible for the development, implementation, assessment, and maintenance of health programs for the Armstrong campus of Georgia Southern University. She currently works full-time at Georgia Southern University, serves as a member of the Sexual Assault Response Team, and advises the sexual assault student educators. As a public health leader, Jacqueline strives to advocate for health equity, to create a culture of wellness, and to actively engage others in changing behaviors through best practice prevention initiatives. Welcome, Jacqueline.
Hi, everyone. Thank you, Melissa, for the introduction. And I'm impressed because most people typically butcher my last name, so thank you, which is okay, but it definitely happens with my very long first and last name. So hi, everyone. We have a lot of people joining. I'm really excited to present and have this opportunity to talk to you about bystander intervention. I'm going to share my screen now so we can get started with that. Can everyone see it? Okay. Okay. If you have any questions, Melissa, if you can keep track of the chat for me, I will try my best to look at it, but I will try also my best not to get distracted by the chat. If there's any questions, I do want this to be engaging. I know sometimes that we can have death by PowerPoint, so my goal is to hopefully not do that, but also present the key topics within bystander intervention and the role of bystanders. So as you all know, this session is titled The Role of Bystanders in Creating Safe Environments, a Call to Action. My research, as Melissa really emphasized, is in sexual assault and interpersonal violence, gender-based violence, and I am really excited that GPHA actually asked to have this presentation because we don't commonly think of interpersonal violence as a public health issue in many ways, and APHA is really taking last year with their conference being violence prevention, taking a strong stance in that as well. So I'm excited to be spearheading that and having the conversation with you all today. As Melissa mentioned, my name, and then I am currently serving as a visiting instructor within the College of Public Health at Georgia Southern. So today we're just going to be talking about in part one, which will be very death by PowerPoint, is objectives and definitions, the Georgia law regarding rape and sexual assault, bystander effect with bystander intervention and diffusion of responsibility. Then part two is really our call to action response, Genesee, and then some resources. And we'll go through what Genesee is, if you do not know. Our objectives for today are going to be to identify 4 strategies. I'm not going to read all of these to you, defining some key definitions and then understanding my importance, my role to you is to understand the biggest takeaway is I want you to understand the third one, which is where to find resources nationally and locally, where to utilize the resources within your communities in Georgia. I do want to pause very quickly and talk about that we are going to be talking, as I've kind of foreshadowed, about sexual assault, rape, force, etc. Some content that you may learn may be triggering or upsetting. So I just want to take some time to give you the go ahead. I know many cameras are off, but if you need to turn your camera off, that is acceptable. If you need to walk away, take a breather, drink some water, go to the bathroom, turn me down so you can't hear me. The main thing is please take care of yourself. The point of this breakout session is to really have an enriching discussion, but I also want to emphasize the importance of taking care of yourself. And if you need to leave and go to a different breakout session, that's also very acceptable. I am not monitoring everyone, so please just know that that's an open invitation to do so. This is a virtual space. Some of the things we may be talking about are going to maybe arise some questionable feelings. So I do want you to know that this is a space of mutual respect and sensitivity. We want to keep in mind that all of the information in these slides are taken from evidence-based websites and resources such as RAIN, which is my all-time favorite. It's very user-friendly. It's spelled RAINN. It means Rape, Abuse, Incest National Network. They we'll do a quiz in here, and that one always has some people having questions. So I did not make these up out of my head. They are evidence-based quizzes. So, and then I will be providing resources at the end. I know that was a lot, but I like to take a lot of time on that slide because it is really important. So part one, as I said, Georgia law, definitions, and bystander effect. Okay, lots of definitions. The ones I want to highlight here, I will make sure that these slides, I know the session is being recorded, but I'll make sure the slides are available as well. But the key definitions I really want to touch upon are sexual assault. That means sexual contact or behavior which occurs without explicit consent. In the state of Georgia, there is nothing within the law that talks about consent being freely given or affirmative consent. That is in the state of Georgia. That is not reflective of other states within the country. What is consent is an agreement between participants in engaging in sexual activity. Best practice is verbal, and that is really being emphasized. Consent can also be given in a nonverbal way. Non-consensual pornography, that one is like a very, to me, dictionary term that most people know it as revenge porn if someone is sending explicit pictures without your consent. And then rape, which is sexual penetration without consent. We'll talk about Georgia laws within that as well. Okay, some time for you all. So does anyone know the Georgia law for rape? We'll just go with what the Georgia law is for rape explicitly, not non-consensual pornography, not sexual battery. Put it in the chat. Feel free to unmute if you're comfortable. No one? That's okay. I didn't know it beforehand, before I really honed in on this topic about 5 years ago. The Georgia law is actually really interesting. It does not align with the national law. So nationally, rape is considered penetration between two people. Does not matter the sexual orientation or gender of that person or biological sex. So the interesting part about Georgia is that rape is only considered under carnal knowledge, which means that that is penetration of a female sex organ by a male sex organ. So you actually cannot be charged with rape if it was a female raping a male, or a female to female, or male to male. That actually cannot be charged as rape in the state of Georgia. And that is actually charged under aggravated sexual battery or sexual battery, which are not, one is a misdemeanor. Aggravated sexual battery is a felony, and so is rape, but aggravated sexual battery, in terms of terminology, I think really kind of decreases the impact that survivors may feel with this when they're wanting to get justice for what has been done to them. it's hard, I guess, for me when I learned about that. How are you all feeling about knowing that this is the Georgia law if you did not know already? Do you feel like this is current or up to date with current trends within our nation? The Georgia law. Not current. I agree. I think it's pretty outdated. I think as public health professionals, as public health advocates, as nurses, as people who are really on the ground, we need to be advocating for change in the Georgia law. We also serve as jury members, as leaders within our communities, and having conversations and understanding the Georgia law and how that has an impact on survivors, trauma, care, the long-term effects of that. We really need to be advocating to match the national law rather than having this kind of carnal knowledge law, but I completely agree. Okay. So what is bystander effect? Bystander effect is my favorite thing. Once you learn what diffusion of responsibility is, if you do not know, it is so fun to see it just like out in society happening all the time. So does anyone know the difference between bystander effect and diffusion of responsibility? And again, feel free to put it in the chat or unmute. Again, difference between diffusion of responsibility and bystander effect. So bystander effect is when I feel happy. I'm teaching you all some really great terms. So bystander effect is when people do not do something or do not intervene because there are other people around. There's a bystander. Yes, people wait for someone else to move, make the first move. That's diffusion of responsibility. So we see this happening all the time. Out of the context of interpersonal violence, you see this happening within a classroom. For instance, when I'm teaching and I say, does anyone have any questions? Or we can use this as an example. This session, we wait until someone else does it, right? We wait until someone else starts the first question, until someone else puts something in the chat, until someone else raises their hand, because we're diffusing responsibility. And that is relevant within sexual assault as well, because we see that it's an even deeper topic. It's a more sensitive topic for people. So there's going to be even higher levels of diffusion of responsibility. I mean, it's common in our language. You'll hear people say, well, it's not, not my problem. I don't want to get too involved. And we see that's why people don't decide not to intervene, because of this diffusion of responsibility. I don't know if anyone has heard of the story of Kitty Genesee. I apologize if I messed up her last name. She was actually in New York. I believe it was in the early mid 1900s. It was like 1914, but she was actually murdered. And we all know New York is very crowded. There's a lot of people are hearing everything, and no one reported. So she was actually murdered. And what happened, the person assaulted her in the alleyway, and they heard it. People heard it, no one reported it. And then the perpetrator actually left and then came back and murdered her, and still no one reported it. But when the police officers went around to the buildings, everyone said, I heard it, and I assumed someone else was going to report. So that's a topic to think about, that unless you see someone there doing something, then diffusion of responsibility is, we kind of have to combat that within our minds. So just a couple of reasons, like I said, why people won't intervene. So I don't know what to say. I don't want to cause a scene. A big one is, it's not my business. I'm sure someone else will step in. I think as all of you, if you have a nursing background, I think it's a little different mindset, because in my opinion, I think nurses a lot of times are, they really do want to help people in a lot of ways. So I think it's a little easier for you to combat that diffusion of responsibility here. But understanding the population as to why someone may not intervene. Okay, we're gonna have some fun. This is probably one of my favorite quizzes, because there's a question here that people throw people off. So I'm gonna start with the first one on the top left. If you want to put it in the chat, that would be great. What you think, is it true or false? So when someone invites you back to their place, they clearly want to have sex. True or false? False, okay. I think we're getting majority false. True, true that it's false. Right, false is right. So the next one is going down, just down the list on the left. Rapes are rarely reported to the police. True, okay. True, okay. Good job. Rapes are rarely reported to the police. So when we see statistics about sexual assault and think about movements such as the Me Too movement or trial cases of assault, there actually is a correlational spike with large media cases to number of reports. So people actually typically will see higher reporting after a large event such as that. But the thing to remember when we talk about sexual assault or interpersonal violence is a public health issue. The statistics behind them sometimes do not show what's actually happening. We don't have the data that really shows, okay, here's how many reports are actually, this is actually what's happening, because we're having very rare reports to the police. So there's kind of a disparity there of the actual amount happening compared to the amount reported. And this is really common within sexual assault and interpersonal violence compared to any other crime. Okay, people who have been sexually assaulted are calm and controlled. True or false? Okay, we have some both. We have true, some false. This is the one that throws people off. This one is actually true. The wording of it, I think, can throw people off. Again, this is all from Rain. I did not make these up upon my own. This is true because when someone experiences trauma, there is not one prescriptive way that they're going to act. How I think about this in terms of sexual assault and trauma is, let's use a different example. Let's say someone's in a car accident. That's a traumatic experience. It happened suddenly, you were not prepared for it. And there's some people after a car accident, they're calm, they're cool as a cucumber. They are handling what they need to handle. And there's other people, such as myself, who are hysteric. They're crying, they can't handle, they are extremely emotional. So when, as a nurse, when you're working in the field, when you're working with patients, if you're seeing people who are coming to you and are telling you that they're assaulted, but they're very calm, they tell you the story, that is an acceptable way that they are dealing with trauma. And I think a lot of times that gets misinterpreted as a false report. I'll go into here, I guess, a little bit. Can anyone guess the percentage based on research of the number of false reports? So just give me a percent that you think are false reports. Okay, 10. Okay, there's definitely a range. We have 1, 2, we have 70. So the media definitely skews this. research actually shows only 2 to 8% are falsely reported, meaning 2 out of 100 or 8 out of 100 are falsely reported. So we're seeing media really skewing this to emphasize, false reports. We see that a lot within media, but it's important to note that the statistics are actually extremely low for false reporting. So if someone comes and is calm and controlled, the likelihood of them falsely reporting that is extremely slim in terms of a statistical standpoint. Okay, moving to the next one. Sexual harassment is not a form of sexual assault. True or false? False. We're having a lot of false. Okay. False. That is correct. Sexual harassment is within its own. It is not rape if the people are dating and or they have had sex before. False. You all are correct that it is false. Having sex at one point during one time does not mean consent at a different time. Okay. Oops, I think I clicked it too fast. Okay, I didn't. Yay. Flirting indicates interest in engaging in sexual behavior. Some of these are a little more, I think, obvious than others. False. Yep, you all are correct. This one we kind of already talked about. So there are not that many false reports of sexual assault. True. Yeah. Most rapes are perpetrated by a stranger. True or false? This narrative is actually really interesting because if you look at research prior, I would say probably early 2000s, you're seeing a lot of reporting of saying, oh, rapes are commonly perpetrated by strangers. And this narrative, you actually see a really cultural shift of this, that many people now know otherwise. They know that commonly rapes are perpetrated by someone that you know, or someone within a social circle that you have. So it's interesting to see the cultural shift of this as well. But you all are correct. False. And this one, if both parties are drunk at the time of assault, no one is accused of rape. True or false? False. Good job. Correct. False. The initiator is typically accused of rape. You have to also think in context of Georgia, let's say it was 2 females, then technically no one can be accused of rape because of the Georgia law. They would actually be, again, charged with aggravated sexual battery. They would not be accused of rape because they can't even be charged with rape in the state of Georgia. Okay, part 2. So this is building rapport. I hope this relates a little bit more to nursing. Again, my background is not in nursing. I know you all are probably in different fields within nursing, but the important part here is creating a common language, regardless if you're working as a nurse or if you're working in public health or just within your communities. I think once people, what I've noticed is I'm a victim advocate. I do not work currently as a victim advocate, but once people find out I'm a victim advocate, they typically will tell me things they may not have told me if I was not a victim advocate. So being able to have the training and knowledge of how to respond in any context is valuable, in my opinion, because you can teach other people how to respond as well. And you can become a safe source for someone to tell you something. And it also, I think, allows for the ability to understand trauma and the neurobiology of trauma, but understanding exactly, like I said, if someone's calm and controlled, you can recognize, okay, this person is still experiencing trauma and I still need to respond to this. Another thing I do want to talk about in part 2, I obviously am quickly going through this because we only have an hour together. This itself is a 40-hour training, so I will not be keeping you all for 40 hours. So this is really a very brief, we're just kind of lightly dipping our finger into the water. So if someone is interested in more training and Sane training, which we'll talk about, or victim advocate training, please let me know. Genesee does offer it for free. And that again is a much more comprehensive, long training. So supporting roles. The supporting roles that I thought were probably the most applicable to this group is just understanding, as we know, everything has 20 million acronyms. So I'll give you some more. SART is commonly a community-based team that stands for Sexual Assault Response Team. That's typically a multidisciplinary team. So a lot of times you'll see within, for instance, Georgia Southern SART, you'll see Title IX, you'll see police officers from the community and from campus. You'll see rape crisis centers serving on the board. So SART is really a lot of different areas of a team that help to coordinate responses. And then also the training within SARTs, so you're all having a very common language when speaking to survivors and ensuring that you are not taking that power continually from them, that you are giving them that power back in order to make the decisions and coordinate the response that they would like. For instance, for SART, if someone were to come to me and I'm a responsible reporter, we have to then report to Title IX, but Title IX then gives the student back the power in saying, what would you like to do with this? Do you just want resources or do you want to move forward? And that is intentional, and that is trained through a SART team typically. So a SANE is how the middle one is pronounced. It is a sexual assault nurse examiner. This is a specialty trained nurse. So any RN can actually gain SANE training, which the SANE training is the forensic exam that's conducted after an assault occurs. It's more comprehensive care, but this also, the main point is the third one, that a SANE can act as the expert testimony if the case goes to trial. So the SANE is more of like the very clinical based version of the role, but there's a huge lack in SANEs, and what I've noticed is many of them have been in the field for a very long time. So there is a definite need for new SANEs to come in and be trained and then be utilized within rape crisis centers within your community. The other role, as I said, is a victim advocate. That is more, again, the word kind of gives it away, an advocate. So they're really supporting you, accompanying, providing education, helping just with information on advocacy, ensuring that the rape crisis center or the SANE are treating the survivor with best practice and making sure that really protecting the survivor and making sure that they are supported in their journey of recovery, whatever journey that looks like. The advocate is really there to help support that. They cannot be a testimony or witness in any way. So they really act as kind of a neutral outside party. Okay, response to a survivor. I think this is a really, really big topic I want to hone upon. Believe and support survivors. And I talked about survivor power. So a lot of times with assault, with interpersonal violence, with gender-based violence, there's a lot of power taken away. The perpetrator has taken power from that survivor. The goal of any respondent in any form that you're responding is to give that power back and be very intentional about that when you are talking to someone. Not saying, here are the resources, this is what you're going to do. Saying, is this something you want to do? Do you want to move forward? And if they say no, then respecting that. For instance, I have an example. I was with someone and they said, I don't want anything. I'm done with this. And someone I think could say, because you want to serve, you want to help them. You want to say, but wait, like, let me help you. Let me, give these things to you, which is in a way selfish because that's taking that power again from them and telling them, if they say, no, I'm done, I don't want to do this, then your role to give power back is to say, okay, I hear what you're saying. here is what is available if you would like it, but I understand your decision and I'm here to support you in whatever role that you would like me to be in. And that is a huge part of the language that needs to be, I think, trained and very intentional within our communities and within our healthcare system when people are reporting in order to give that power back to the survivor. And some, I know I've used survivor and victim interchangeably. That's actually an interchangeable word. Typically, the recommendation is if someone is saying, you know, I'm a survivor, then you use that language that they're using with any rapport. If they're saying victim, you typically will use whatever they're using. Sometimes in some rapport, they actually tell you to avoid using either one because they may not identify as that quite yet, depending on where they're at in their stage of recovery. So it's really important. I should have italicized, starred that one, but survivor power is extremely important. A nurse's role, as you can see, the study's from 1981. So serving as multiple functions. As a nurse, this role is so important because you are someone who is a trusted source. You're someone that people want to connect with. You spend a lot of time with people, and understanding your role, if you are wearing the nursing hat, understanding, do I have to report this? If so, my recommendation is always to, if you know what's kind of leading, say, I'm sorry, I don't mean to interrupt you. I appreciate the courage to tell me and talk to me, but I do want to let you know before anyone tells you anything, I do want to let you know that I have to report this. That's one of the struggles that we have within the university at times, is people knowing that they're responsible reporters, because this actually happened to one of my coworkers. Someone felt comfortable with her, shared a story with her, and she did not realize she was a responsible reporter. So then had to go back and tell the student, hi, I'm a responsible reporter. I now have to report what you told me, which completely broke the trust of that student. So it's really important before that happens to say, I want to let you know, but here are the confidential reporters, which typically are counselors within our university. It's the counseling center. If someone reports an assault to them, they do not have to report it to anyone. So knowing within your community who are confidential reporters, your rape crisis centers that will have counselors available, they're going to be confidential if the person does not want to report. So that is an area to know where that person is located or where those resources are located in your communities. And as you know, like I said, 1981, there is a lack of research. I had trouble finding research on the impact of nurses' roles with sexual assault survivors. So if anyone wants a research area. So call to action, this has a lot of stuff in it. So I'm not gonna, again, read it all, but these slides will be available. So showing you care. One of your objectives was to understand the 4. This is a common term or a common acronym. So we have SART, Sexual Assault Response Team, Sane, which is Sexual Assault Nurse Examiner, and then we have CARE, which is another acronym. It means create a distraction, ask directly, refer to authority, and enlist others. So that is actually it. RAIN says show your care, so or show you care. We use actually Georgia Southern Cares, so we actually use the acronym and tailored to our university, and that is a form of bystander intervention. Obviously, within the nursing field, this may be different, but if you are, walking on the street somewhere and you see something happening, these are some options. So creating a distraction, asking directly if you're comfortable with that, referring to authority, and then enlisting others. I think those are all pretty self-explanatory. If you need any additional resources, that they're in my references, and you can also look up CARE and then RAIN, and they can give you more information as to that. Any questions about this? I think the important point of the call to action is to ensure, as I talked about, the language. I believe you. It took a lot of courage to tell me it's not your fault. You're not alone. I'm sorry this happened to you. Those are all really important language that we all need to be having with anyone that reports anything to us, and active listening to give that power back, that we're not solving that problem for them, we are allowing them to solve it. And then continue to support avoiding judgment, realizing that trauma, and again, the neurobiology of trauma can present itself in a lot of different ways. So it's really important to avoid judgment. If someone comes in and they are calm, not assuming something and avoiding that judgment. Oh, well, are you sure you were assaulted? Because I've heard this. Are you sure you were assaulted? Because you're acting very calm. And me as a victim advocate, almost like fall out of my chair, but people say that's said. So it's really important when we are leaders within public health to change that mentality and change that vocabulary and create this call to action, that our actions and our words matter, and they do have an impact. And then really just knowing your resources. Suicide prevention hotline is on here because commonly with any sort of trauma, especially sexual assault trauma, there will be suicidal ideation. So knowing the suicide prevention hotline and how to get people help, and then definitely encouraging self-care. Okay, you may have seen some bicycles throughout this entire presentation, and you're like, we're talking about sexual assault and gender-based violence. Why are there bicycles in this presentation? Has anyone read the book Know My Name by Chanel Miller? If you're an avid reader or an Audible person, such as myself, I would highly recommend this book. It is, again, called Know My Name by Chanel Miller. She was the survivor of the Brock Turner case. And she talks about in her book, there's a quote that says she hung 2 bicycles over her bed at night because it made her feel safe, because the people who intervened in her assault were riding bicycles. So it made her feel safe. And it also emphasizes the importance of being a bystander and helping and seeing something and taking action. So again, your actions matter. And that's why you see bicycles throughout this presentation. This is the Georgia Network to End Sexual Assault. Genesee is typically how it's pronounced. Their mission is to recognize authority and partnerships. Genesee is a really great resource. So for Georgia specifically, Genesee and RAIN, as I said, RAIN is nationally, while Genesee is going to be our state organization. They have resources. They're the ones that put on Sane training, victim advocate training. They do some workshops for law enforcement. They have a lot of options. I would definitely recommend checking out their website. They also have a map, which I will show now, of sexual assault centers within the state and who covers what counties. The website is here on this page, but you can also find it. I can make sure or try to get the handout out, but I would recommend using that website. This just has that. So if you're within any of these counties, it's important to know what sexual assault center is going to be covering your area and that you can refer anyone to. And then these are just some resources. They're all really great evidence-based resources. You'll see all different variations. Violence, up here is RAIN, and then on the right is NSRBC. Those are 2 very big sexual assault resources. And then I just want to give some acknowledgments to Georgia Southern Student Wellness and Health Promotion. They really spearheaded this on the Georgia Southern campus, and I utilized some of their slides for this presentation. And then Georgia Southern SART, which I serve on, and they also worked with student wellness to create this, and then Genesee using some of their resources as well. Thank you. I know that was a lot. So are there any questions, comments, anything I can help clarify or answer?
Thank you, Jacqueline. That was really fantastic. I do have a question. I noticed that you said responsible reporter, and I think we're really used to the term mandated reporter. I like the way responsible reporter sounds because it doesn't mandated kind of say feels like we're forced to do something, not that we would want to do it. Is that a term that they're trying to shift towards from mandated reporter?
So the interesting part about responsible reporter is that has actually been terminology for a while now, but mandated, it's one of those terms that like mandated reporter is just what's in our brains. It's been in there forever. So it is really common within a policy. A lot of times you'll see responsible reporter. If you see mandated, I would recommend, telling someone if it's in your policy, hey, the best practice terminology is actually responsible reporter. I prefer responsible reporter as well. And that's why I intentionally use it, but it's the same thing. I agree. The vocabulary seems a little bit more or less forceful. I see a question in here from Shannon. Are youth leaders responsible or mandated to report? So they're actually responsible and mandated reporting, as Melissa kind of mentioned, they're actually the same thing. So being a mandated reporter is the same thing as being a responsible reporter. Responsible reporter is just the up-to-date best practice terminology. In terms of at your church, I would recommend reaching out to find out, because each organization typically has different policies of reporting. And again, I would say it depends on what hat you're wearing. So for instance, for me, while I'm at work, obviously I'm a reporter, but if I was at dinner with my friend and they let me know, then I'm not a responsible reporter at that time. So but then my victim advocate kind of hat goes on. So there's a lot of variation there. My recommendation for that would be to always ask if someone were to report to you as a youth leader, are you responsible to report, and who do you report to within that church? Do you report to someone within that church, or do you is it required to report to the rape crisis center? Do you take that person there? I think within a lot of organizations, there's not a lot of infrastructure or policy structure as to what to do. So then that, again, decreases in the amount of reports, because if someone comes to you and you're like, I don't know, then that's also, they just experienced trauma. So they'll probably, take a step back as well. So it's important for you as the leader to know what the steps are for yourself. You're welcome. Any other questions? Feel free, like I said, put them in the chat or unmute. Any questions? I've gotten them probably all, so.
I have one more. With the description of the criteria for rape and for aggravated sexual battery, and a really recent focus on health equity, is there any push to really move that terminology in a different direction? It really seems like it lessens and makes light of trauma that is done to people who aren't male on female. I never thought that I would consider a rape law non-inclusive, but it truly is.
Not that I'm aware of, no. The newest initiative in sexual assault for Georgia has been the rape kit log. So Georgia actually doesn't have a backlog that's typically, talked about within rape kits. They are trying, which would be really great. I think the law should definitely change, but I do not know of any conversation to change it to reflect the national policies. But the most recent update of what Georgia is doing is they are actually trying to start a online database. So you can almost let's say you get blood drawn at your primary doctor and you can kind of see the steps. Oh, it's like here, it's with the hematologist here and they're doing this with it. So they're trying to do that same thing to empower survivors to know what is happening with their kit, where it's at in the process. So they're trying to build an online platform to really track that. So we're not seeing this log or lack of kits not being processed. So that's the most recent, that's separate, but in terms of law, I do not know. I have not heard anything or seen anything from Genesee. I know Genesee did post I think it was on Facebook, a stance, a statement of position about inclusivity within sexual assault, and I know it had was not received well. And again, that is my email. If you do have any questions or want to talk deeper about anything, please let me know. Is there a need for more SANE nurses in Georgia, and do they usually work in hospitals? So there is a SANE need in all over America. Georgia, yes. I do not know the statistic off the top of my head in terms of need. Usually, what I have seen is SANEs typically, they are trying to initiate more SANE training within hospitals, but they typically volunteer or work within the Rape Crisis Center, that if someone comes into the Rape Crisis Center, they are able to provide a forensic exam there rather than transporting someone to the hospital. Depending on where it's located, or if it's a more rural community, I think that depends upon the community built environment as well. Again, I know I gave a lot of content, so if you need time to process, please email me with any questions, or reach out. This is a lot of information again, so process, but I'm here. I appreciate all of you taking the time to come to this breakout session and listen. I think this is a really important topic within public health, and that there is a lack of education within our public health workforce. So if you're interested in anything, please let me know. I would be happy to talk to you about how to build programming or policy infrastructure, any of that. I would be happy to have a conversation about and connect you or assist in what I can. So
I definitely want to say thank you again. And I do like how you mentioned public health, because we do see, we serve a wide variety of populations. And I know in our local clinic, we have done some training, on human trafficking, and how public health tends to be a location that a lot of traffickers will bring their victims, because of, we don't have the barriers to service with insurance and things like that. So we really do have a high opportunity to see women that have been assaulted, both as a trafficking situation and in non-trafficking situations. So we're definitely, we definitely have a need to make sure that we're educated on the needs of our population for sexual assault. So thank you so much for that presentation. That was truly informative. I just want to remind everybody, we are going into a break when we go back to the main room. So if you click the leave room button, do not go further and leave the meeting when you get into the next room. We will be on a break until 11:15, and then it'll reconvene for the rest of the conference. Okay.